At this point, I'd like to welcome you to module number 2. I hope that the first module went smoothly for you and that you were able to better understand some of the background information for why spine boarding occurs. Within this module, you will need your dermatome and myotome sheets that are included within your instructional packet. So at this time, try and make sure that you have those out and available for you. The very first thing that you want to do whenever you believe that an athlete is injured is to make sure the scene is safe. And this is not only for the athlete's continued safety, but for yours. So before you run out onto the court, field, or wherever the athlete is, you need to ensure that either the game has stopped, has moved out of the way, or that the athlete is in a position where you are able to actually physically go get them without risking your life. It is important that if the athlete is in a place of danger, that you as the healthcare provider must make the conscious decision of, is it better to go help him and possibly risk more people being injured, or to wait until better help arrives to get the athlete into a better situation. When you arrive out to the athlete, the very first thing that you're going to want to do is to stabilize the head of the injured athlete. So if you as an athletic trainer see the athlete go down or your patient go down and you believe that there is a cervical or a head injury, you want to make sure that you instantly stabilize the head and tell the athlete to not move. When you get out there, you're going to want to make sure that your hands are securely around the patient's head. And there's a few different methods of this. Some people choose to put their hands right behind the ears of the athlete. Others choose to use more of their forearms to stabilize. Either way is okay as long as you are able to fully stabilize and not move the patient. So as you, the athletic trainer, is out there, you're going to want to palpate around to see if you can feel anything. So I prefer the hands behind the head method, and why I do this is when my hands are back there, I'm able to palpate around and see if I can feel any abnormalities between the spinal vertebrae and any of the surrounding musculature. So what we're looking for at this time, we're looking for any possible dislocations where you can feel the vertebrae. We're looking for any pain. So if I'm palpating down the athlete's spinous processes and he's complaining of pain, I know that something potentially could be wrong on the bony landmark. And I'm also looking for any abnormalities. If something is different on the right side versus the left, that's something that you want to be clued into, that this is not normal for that patient. At this point, I would like for you to pull out your dermatome color sheet. And you can see on the right that there is a picture of the dermatome sheet very similar to what you did. And what the instructors of this did is they colored them by segments. What I'm asking you to do at this time is to color each different segment a different color, so that way it's easy for you to see the switches from levels from C1, C2, C3, and so forth. This is a good way that you will be able to then quickly and easily trace out the colors of where it is. So to do a dermatome assessment, the very first thing you're going to want to do is to do a light touch on the patient, and this can be just brushing your hand on the athlete's skin. Another touch that you can do is a firm touch, and this is where you're going to push down with a little more power and emphasis, but it's just going to be a little bit harder of a touch than the light touch. The third one's going to be a painful touch, and this is going to be either digging your nail into the patient or using something such as like the pointy tip at the end of a reflex hammer. Now there's a few different reasons for these. So you want to use a variety of the different touches. One reason for this is if the patient has some type of mild spinal cord injury, they might not be able to fully sense the light or the firm touch, but if they can sense painful, sometimes that means that some of the receptors are still intact. Another thing that we need to know is to see if the athlete can sense the differences in sensation. So are they able to, per se, feel the difference between a light touch and that of a firm touch? When you're going through the dermatomes, what you want to make sure is you have the patient's eyes closed. And what you're going to do is you're going to rub your hand using one of the 3 touches on the athlete's related spinal cord. So let's use C5, for example. So we're going to go down the lateral side of the forearm. And as I'm palpating down, I'm going to do a light touch there. With the athlete's eyes closed, I'm going to ask them where I'm touching, so they should reply on the outside of my right arm. And they should also reply that they feel a light touch. And then you're going to do these different touches all throughout the body. If there's a certain point in which the athlete has an altered or different sensation, that is the associated nerve root that you know something is wrong with related to the spine. So all these numbers that you see, C2, C3, C4, C5, and so on, that relates to the spinal cord and the vertebra at that level where something is wrong. So at this point, I would advise you to please pause this video and to be able to complete the coloring assignment. So now that you've talked about dermatomes, the next thing we're going to go over is myotomes. And myotomes, as referenced in the name, refers to muscle. And myotome testing is performed by holding the position associated with the related nerve root for a 5-second break test. So let's give an example here. Say we're using elbow flexion. So we know that this is the nerve root, as you can see on your sheet as well as on the screen, with C5 and C6. You're going to have the athlete bend their elbow up into a little bit of flexion, and you're going to try to pull away as they try to keep their elbow into flexion. If the athlete's able to withstand this, then you know that that nerve root is intact. So here's one thing I want to talk through. So we have a patient who's laying down on the ground and has a potential spine injury. Some of these motions are going to be a little bit more than we want to do as an athletic trainer because we're going to be causing some additional motion. One way to quickly test this and to see if the extremities are intact muscle-wise is to have the athlete squeeze your finger and wiggle their toes. So this is a short, simple way of seeing that their myotomes are intact because you're going to get the most distal part of the upper extremity and the most distal part of the lower extremity. And that can be a really quick clue in to tell you what could be wrong with the patient.